This is All India Radio. Good afternoon. I am Lalema Aneja Dang, and with me is Anita Anand with the Midday News. The headlines. Prime Minister Narendra Modi discusses COVID-19 situation with leaders of different political parties through video conferencing. Home Ministry directs states to ensure availability of essential goods at fair price for citizens. Health Ministry says 402 patients recovered in the country so far, 773 new confirmed cases of COVID-19 reported during the last 24 hours. Government to set up 3 levels of healthcare facility for management of COVID-19 cases. Several agencies and organizations come forward to help country in the fight against novel coronavirus. And UN suspends deployment of peacekeepers till the 30th of June in the wake of coronavirus pandemic. Prime Minister Narendra Modi today held an all-party meeting with leaders of different political parties through video conferencing. The Prime Minister discussed the future course of action with them in light of many states demanding an extension of lockdown after 14th of this month as a precautionary step in the battle against COVID-19. Our correspondent, quoting sources, reports economic impact of the shutdown and measures to deal with it was discussed. Utilization of money released to states and concerns pertaining to daily wage workers and migrant workers were also discussed in detail. Many leaders have asked the government to extend the lockdown further. Some leaders also urged for making suitable provisions for ensuring free or cheaper testing facilities for the COVID-19 patients. Opposition leaders also demanded for a greater financial stimulus to the states by the centre. Congress leader Ghulam Nabi Azad, Shiv Sena leader Sanjay Raut, DMK leader T.R. Balu, Sharad Pawar from NCP, Rajiv Ranjan Singh of JDU, Lok Janshakti Party's Chirag Paswan, Professor Ram Gopal Yadav of Samajwadi Party, BSP's Satish Chandra Mishra were among those who participated in the interaction with the Prime Minister. Home Ministry has directed states to ensure availability of essential goods at fair prices for public at large. In a letter to Chief Secretaries, Home Secretary Ajay Bhalla has asked the states to deal strictly with offences of hoarding, black marketing, profiteering and speculative trading. He asked them to ensure proper supply of food items, medicines and medical equipments by invoking provisions of Essential Commodities Act 1955. Mr. Bhalla emphasized that measures including fixing of stock limits, capping of prices, enhancing production, inspection of accounts of dealers and other such actions will be undertaken by the states at the earliest and at regular intervals to ensure production and supply of essential commodities. He said that those not complying may be dealt with severely as offences under Essential Commodities Act are considered as criminal offences and may result in imprisonment of 7 years.
Health and Family Welfare Ministry has said that classification of health facilities and hospitals have been done to deal with the corona patients in the country. In a briefing yesterday, Joint Secretary in Ministry of Health and Family Welfare, Love Agrawal, said that 3 types of healthcare facilities will be set up for various categories of COVID-19 cases as a mechanism to provide care to COVID-19 patients. He said these 3 types are COVID care centres, dedicated COVID healthcare centres and dedicated COVID hospitals.
एक कोविड केयर हॉस्पिटल और कोविड केयर हेल्थ सेंटर से मैप्ड हों ताकि यहां पर जो पेशेंट्स रखे जाएं, जैसे मैंने कहा है जो माइल्ड है या सस्पेक्ट केसेस हैं, अगर नीड हो तो उनको किस पर्टिकुलर हॉस्पिटल में फर्दर केयर के लिए लिया जाना है वह क्लैरिटी वहां पर फील्ड पर हो. सेकेंड टाइप ऑफ सेंटर्स आर डेडिकेटेड कोविड हेल्थ सेंटर. दे आर केयर सेंटर, दीज आर हेल्थ सेंटर्स. और इन सेंटर्स में उस टाइप के पेशेंट जो कि क्लिनिकली मॉडरेट लेवल ऑफ सीरियसनेस है उनको मॉनिटर किया जाएगा, जिसकी प्रॉपर ट्रायाजिंग, सेपरेट एंट्री एग्जिट या जोनिंग हो ताकि किसी भी तरह के इन्फेक्शन स्प्रेड का खतरा ना हो. और इन सब हॉस्पिटल्स में बेड्स एश्योर्ड ऑक्सीजन सपोर्ट के साथ होने चाहिए. तीसरा टाइप ऑफ क्लासिफिकेशन इज डेडिकेटेड कोविड हॉस्पिटल्स, जो कि हमारे सीवियर और क्रिटिकल केसेस हैं. ये हॉस्पिटल भी या तो फुल हॉस्पिटल हो या डेडिकेटेड ब्लॉक्स हो.
The ministry said suspect and confirmed cases should not be allowed to mix under any circumstances. It said all suspect cases irrespective of severity of their disease, will be tested for COVID-19. Quoting a recent study of Indian Council of Medical Research, Mr. Agarwal said if one COVID-19 patient does not follow lockdown orders or practice social distancing, then the patient can infect 406 people in 30 days. Quoting the Health Minister, Dr. Harshvardhan, said social distancing is a social vaccine to manage the COVID-19. He urged the people to adopt social distancing measure to deal with the coronavirus.
जैसे कि मैं इससे पहले आप सबको बताता आ रहा हूं कि हमारी दो स्ट्रैटेजीज हैं इन टर्म्स ऑफ मैनेजमेंट ऑफ केसेस. एक हम बोलते हैं क्लस्टर कंटेनमेंट स्ट्रैटेजी, एक हम बोलते हैं जहां पर थोड़े ज्यादा केसेस आते हैं तो अगर वो एक आउटब्रेक एमिनेबल टू मैनेजमेंट. इन दोनों स्ट्रैटेजीज के तहत हम जैसे लॉकडाउन या सोशल डिस्टेंसिंग एक मेजर है, इन टर्म्स ऑफ कंटेनमेंट मेजर हम इस पर्टिकुलर स्ट्रैटेजी के तहत जिस टाइप के केसेस वहां हैं उसके तहत हम उस पर कार्य करेंगे.
Meanwhile, a total of 773 new confirmed cases of COVID-19 or novel coronavirus have been reported in the country during the last 24 hours, taking the total number of cases to 5,194. Health and Family Welfare Ministry said 402 patients have recovered so far and 149 deaths have been reported in the country so far. Delhi Lieutenant Governor Anil Baijal today appealed to all religious leaders, resident welfare associations and parents to advise the young people to observe the Shab-e-Barat occasion solemnly and not to step out together in the wake of the COVID-19 pandemic. In a message, the Lieutenant Governor said Delhi is under lockdown amidst the coronavirus outbreak. Therefore, the people are requested not to step out from their houses and pray for their family security. He said everyone should desist from any behavior that compromises with the safety guidelines for battling coronavirus.
The centre has taken a number of initiatives to ensure smooth supply of medical supplies amid lockdown. Indian Railways has geared up its efforts to produce personal protective equipment, PPEs, on a mission mode. Here's a report.
Railways workshops are being geared up to produce 1,000 PPE overall every day for railway doctors and paramedics. The production facilities will be ramped up in the future. Railways is also considering to supply 50% of PPE material to other medical professionals of the country. The PPE overall produced by Jagadhari Workshop was recently cleared by Defence Research and Development Organization's lab. Approved design and material will now be used for making protective overall by 17 railway workshops situated in different zones. The PPE overall will offer much needed protection to railway doctors and paramedics working as frontline warriors for treating the corona patients. With Bhupendra, Suparna Sekya, AIR News, Delhi.
In Maharashtra, 60 more cases were found positive for COVID-19 today, taking the tally of coronavirus cases to 1,078 in the state. Mumbai has the most, 44 cases, followed by Pune with 9 positive cases. Meanwhile, 3 more COVID-19 patients died in Pune, taking the death toll in the city to 13. At the same time, the spread of the disease in Dharavi, the biggest slum in Asia, has been a matter of concern as 2 more positive cases were found yesterday.
In Madhya Pradesh, the number of coronavirus cases in the state has risen to 320. 22 new cases have been reported in Indore and 8 in Khargone. 25 people have died due to the disease so far. Bhopal and Indore are among the most affected districts in the state. In Bhopal, the number of corona infected is continuously increasing, and so far 85 people have been infected by it. Meanwhile, many MPs of the state have welcomed Prime Minister Narendra Modi's decision of 30% cut in their salaries and allowances to fund the fight against coronavirus.
Khargone MP Gajendra Patel termed it as a milestone decision.
हमारी सांसद निधि 2 वर्ष की 10 करोड़ रुपए और हमारा वेतन जो 30% की कटौती की है, मैं सभी हमारे जितने सांसद भाई हैं उनकी और मेरी ओर से माननीय प्रधानमंत्री का इस फैसले का हार्दिक स्वागत करता हूं.
While Khandwa MP Nand Kumar Singh Chauhan has also called it a decision on time.
उनके इस निर्णय का मैं स्वागत करता हूं और समर्थन करता हूं. यह सांसद निधि की धनराशि अब कोरोना जैसे महामारी से लड़ने के ऊपर खर्च होंगी.
Governor Lalji Tandon and Chief Minister Shivraj Singh Chauhan have also welcomed it and voluntarily announced their salary cuts. Governor has announced to give 30% of his salary, around rupees 1 lakh, to the Prime Minister's fund every month till the end of Corona crisis. While Chief Minister Shivraj Singh Chauhan has decided to contribute 30% of his salary to the relief fund for 1 year. He will also spend the amount of his MLA fund to deal with the Corona outbreak. Sanjeev Sharma, AIR News, Bhopal.
In Jharkhand, a total of 4 positive corona cases have been reported, while results of 160 samples are still awaited. 2 positive cases from Ranchi, 1 from Hazaribagh and Bokaro each have been confirmed by the state government. Health Department is taking measures to increase the number of tests and identify more number of suspected patients for COVID-19 tests. 1,076 samples of suspected people have been tested in the state so far.
In Assam, the state cabinet has decided to deduct 30% of the monthly salaries of the chief minister, ministers and all MLAs for 1 year. The deducted amount will be deposited in the fund for treatment of COVID-19 patients and management of the outbreak. In regard to the post-lockdown scenario, the cabinet decided to follow the guidelines issued by the centre. Informing this to the media after the cabinet meeting yesterday, Health Minister Himanta Biswa Sarma said the centre's directive would have to be directly implemented by the deputy commissioners. He said the norms of social distancing must be maintained at all levels. Our correspondent reports that 28 positive cases have been reported in the state so far.
There is no let-up in surveillance and screening in the state. 28 positive cases have been reported in Assam so far. However, all of them are stable now. Chief Minister Sarvanand Sonowal appeals citizens to be a part of the fight against COVID-19. In a message, the Chief Minister urged people to contribute as the second line of defense as Swasth Sevak in various fields, including doctors, nurses, paramedics, and sanitary workers, etc. The volunteers will be trained on COVID-19 care and other related issues and will be deployed as COVID warriors. Manas Pratim Sharma, AIR News, Guwahati.
This is All India Radio. Let's take a look at the headlines once again. Prime Minister Narendra Modi discusses COVID-19 situation with leaders of different political parties through video conferencing. Home Ministry directs states to ensure availability of essential goods at fair price for citizens. Health Ministry says 402 patients recovered in the country so far. 773 new confirmed cases of COVID-19 reported during the last 24 hours. Government to set up 3 levels of healthcare facility for management of COVID-19 cases. Several agencies and organizations came forward to help country in fight against novel coronavirus, and UN suspends deployment of peacekeepers till 30th of June in the wake of coronavirus pandemic. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
Several agencies and organizations have come forward to help country in the fight against novel coronavirus. Gujarat-based Amul is one such brand which is not only ensuring the supply of milk to the whole country during the lockdown, but also maintaining the best hygiene practices to prevent the spread of coronavirus. Our correspondent has the details.
With a huge network of around 5,000 tanker drivers, Amul is collecting over 400 lakhs liters of milk per day from the villages and transporting it to 1,000 cities and towns across the country. Managing Director of Amul Cooperative R.S. Sodhi said, right from milk collection to the delivery of milk, Amul is taking all the precautionary sanitation measures in the wake of COVID-19. He said to ensure the milk provided to people is hygienic and uncontaminated, all the farmers and workers have been instructed to wear masks and sanitize their hands frequently. He said all the workers are also being checked by the doctors while entering the Amul premises. Mr. Sodhi thanked centre and state government for the support in ensuring uninterrupted supply of milk during the lockdown. Parna Khun, AIR News, Ahmedabad.
In line with Council of Scientific and Industrial Research, CSIR's special efforts, its constituent lab, Central Electrochemical Research Institute CECRI at Karaikudi in Tamil Nadu, has come out with helping hands to reach out to the society through scientific service in mitigating COVID-19. CSIR CECRI has prepared series of lab-made PPEs that include hand sanitizer solutions as per the WHO recommendations, hand wash solutions using coconut oil and sodium hypochlorite-based disinfectant solutions. These solutions were packed in containers, printed for instructions to use, and distributed to the needy organizations free of cost. So far, around 350 litres of hand sanitizers, 250 litres of hand wash solutions, and 1,000 litres of hypo disinfectants have been distributed. CECRI plans to continue this distribution till the COVID-19 situation restores to normalcy. It has recently started offering digital training of making face masks by interested rural women to help them as well as to cater to the needs of their neighborhood.
Science and Engineering Research Board, a statutory body of the Department of Science and Technology, is supporting a technology by the Department of Biosciences and Bioengineering and IIT Bombay for capturing and inactivation of novel coronavirus, the causative agent of COVID-19. The funding will help the team develop a gel that can be applied to nasal passage, which is a major entry point of the coronavirus. The solution is not only expected to protect the safety of health workers, but can also lead to reduction in community transmission of COVID-19, thereby helping disease management. Given the contagious nature of COVID-19, health providers, including doctors and nurses, are at maximum risk while taking care of COVID-19 patients, particularly asymptomatic ones who cannot be detected and pose a greater risk in spreading the disease. The team is planning a two-pronged approach to limit transmission of the SARS-CoV-2 virus, the causative agent of COVID-19. The first component of the strategy will be to inhibit binding of the viruses to the host cells. It is expected to reduce host cell infection. Viruses will still remain active, therefore raising the need to inactivate them. Secondly, biological molecules would be incorporated which would inactivate the trapped viruses in a manner similar to that of the detergents. Upon completion, this approach will lead to development of gels that can be locally applied in the nasal cavity. Secretary, Department of Science and Technology, Professor Ashutosh Sharma said the healthcare workers and others working in the front line to fight against the virus deserve a foolproof protection. He said the nasal gel being developed in conjunction with other protective measures will provide a strong extra layer of defense.
Centre for Scientific and Industrial Research, CSIR, Centre for Cellular and Molecular Biology, CCMB, in Hyderabad, and Institute of Genomics and Integrative Biology, IGIB, New Delhi, have started working together on the whole genome sequencing of novel coronavirus. CCMB Director Dr. Rakesh Mishra said this will help them to understand the evolution of the virus. He said this study will also help them to know how fast it evolves and what the future aspects of it are. Each institute is continuously working on the whole genome sequencing. In the next 3 to 4 weeks, researchers would be able to get at least 200 to 300 isolates, and this information would help them to make some further conclusion about the behavior of this virus. For this purpose, National Institute of Virology, NIV, in Pune has also been requested to provide virus that has been isolated from various places. This will help the scientists to cover the whole country to get a bigger and clearer picture. This will help the institutes to establish the family tree of the virus. In addition to this, the institute has also increased the testing capacity. Border Security Force, BSF, is at the forefront in the fight against coronavirus. Wherever BSF Jawans are patrolling along Pakistan and Bangladesh border, they are also spreading awareness to fight COVID-19. However, the operational activities are also not stopped. The vigil has been enhanced to prevent any mischief of trans-border criminals. There were also some seizures of contraband items on the eastern and western borders during this lockdown period. Amidst this lockdown, BSF formations have come forward to help people through awareness campaigns, providing face masks and soaps for hand wash, and also providing rations to the needy. In many parts of the country where migrant labour was stuck during lockdown, they were being provided with ration and food.
In Tamil Nadu, the city's civic body in Chennai has organized mobile provision stores, while its planning authority has arranged more mobile vegetable and fruit shops. The move is aimed at helping people to get the essential things easily during the curfew that is in force. More from our correspondent.
During the lockdown periods, concerns used to be raised about the easy availability of essential commodities. To address the issue, the Chennai Corporation has persuaded the retail traders in the city to run 7,000 mobile provision stores. The civic body has said 5,000 three-wheelers and 2,000 mini trucks will be crisscrossing the city streets every day with the provisions. The traders have been asked to sell them by wearing gloves and masks. On its part, the Chennai Metropolitan Development Authority has made arrangements for running 100 mobile vegetable and fruit selling units. The residential welfare associations have been asked to register themselves with the planning authority's website or through phone for directing the vehicles to reach them. Jai Singh, AER News, Chennai.
In Kerala, local self-government institutions and self-help groups are undertaking several measures to improve the life of migrant labourers in the state during this lockdown period. We have a report.
In Kannur in Kerala, Kannur Corporation along with the district administration has implemented Kannur Thali project in which food is made available for over 1,400 migrant labourers and destitutes in the corporation limit. This noble venture is aimed at ensuring that no one remains hungry during this difficult time. Similarly, in Adimali in Idukki district, the police officials and Gram Panchayat members shifted a group of migrant labourers who were found in very unhygienic condition in a very small house with over 85 people living together. They were shifted to Adimali High School and were provided with clean living environment and food from community kitchen. They were also made aware on the practices that should be followed to prevent COVID-19 infection and were supplied with masks and sanitizers. These are representatives of a large amount of work going across Kerala under various local governments who are the true flag bearers of making life better during this battle time to contain COVID-19 in the state. With reports from PTC Kannur and Idukki, Mayusha for AR News from Thiruvananthapuram.
In Karnataka, the Primary and Secondary Education Department has come out with a unique idea to start a YouTube channel that can invoke in children a passion for learning and creative activities during the lockdown period. Our correspondent has the details.
Primary Education Department wants to put out 4 or 5 such videos for an hour every day for the next 50 days. There is no restriction that these videos have to conform to the school syllabus. It has said that the videos could be narration of stories, book reading, puzzles, magic, origami, or any such subject that evoke the interest of children and engage them in activities. Though there is no payment for the videos contributed, the department has promised that such efforts will be acknowledged by the department. Sudhindra, AIR News, Bengaluru.
It's more than 2 weeks now after the nationwide lockdown was announced to contain the spread of COVID-19 in the country, and the lockdown has been very smooth in the frontier state of Arunachal Pradesh. Arunachal Pradesh government is ensuring that essential items reach every nook and corner of the state and no one is left out. Helicopter sorties are being carried out for the supply of essential commodities to far-flung areas not connected by roads. In the capital city, Itanagar, district administration has made arrangements for home delivery of essential commodities through various agencies. LPG cooking gas are also being home delivered.
In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Randeep Guleria, Director, AIMS, said that people should engage themselves in various activities in their homes to keep them mentally and physically fit during the lockdown.
घर के अंदर एक एरिया बना लें जहाँ पे आप घूम के वॉक कर सकते हो. दूसरा इम्पोर्टेंट इशू इज मेंटल हेल्थ. इसमें ये बहुत जरूरी है कि हम लोगों से सोशलाइज करें, घर के और जो परिवार के लोग हैं उनके साथ इकट्ठे बैठ के बात करें. कुछ इंडोर गेम्स खेल सकते हो, कार्ड्स हैं तो कार्ड्स खेल सकते हो, इकट्ठे बैठ के कोई टीवी पे मूवी देख सकते हो. इस टाइप के कई एक्टिविटीज कर सकते हो जिससे आप सोशलाइज भी कर लें. ज्यादा हुआ तो अपने दोस्तों के साथ फोन पे बात कर सकते हो, चैट कर सकते हो, जिससे आप अपने आप को बिजी भी रखो, मेंटली स्ट्रांग रखो और फिजिकली और मेंटली स्ट्रांग रहो. योगा जो है वो आप सुबह उठ के सब लोगों को योगा करना चाहिए, मेडिटेशन करना चाहिए. ये हमारे जो मन में कोरोना के बारे में और सोचने से जो परेशानी है वो भी कम होगी. अब हमारी ब्रीदिंग से हमारी लंग की कैपेसिटी भी बढ़ेगी और ओवरऑल पॉजिटिविटी भी शरीर में आएगी.
Dr. Rakesh Garg, professor in AIMS Delhi, said preventive measures will contain the spread of the coronavirus.
If the social isolation continues in a very nice way, then probably we'll be able to have containment. So there may be some clusters which are upcoming, but with good contact tracing and with good quarantine of those who have suspects or those who have contact with these positive patients, if they can do a good amount of quarantine at respective places, then probably we think that the containment of the virus may be a good option, and we hope that it would happen.
Noted musician and singer Shankar Mahadevan urged people to become Corona warriors by following the guidelines.
आओ हम सब मिलके ये जो कोरोना वायरस के अगेंस्ट जो लड़ाई है उसमें सोशल डिस्टेंसिंग मेंटेन करें, हाथों को अच्छी तरह धोएं, घरों में रहें और लॉकडाउन के नियमों का पालन करें. लेट्स ऑल बिकम कोरोना वॉरियर्स अगेंस्ट दिस ड्रेडेड डिजीज.
Indian woman cricketer Anjum Chopra asked people to stay home to stay safe.
हम सभी के लिए ये एक मुश्किल घड़ी है, पर कोई बात नहीं, डट के खड़े रहेंगे तो इस बीमारी को जड़ से मिटा पाएंगे. बताए हुए नियमों का पालन कीजिए, घर पे रहिए, सेफ रहिए और स्वस्थ रहिए.
Well, people across the country are following government's appeal to stay in their homes during the lockdown period. We spoke to some people who shared how they were utilizing their time during the lockdown.
Vishal, I'm happy that I'm able to, pursue all my hobbies, and once this lockdown is over, then I would be able to, live my normal life. The best positive thing is that you get to spend time with your family members, you get to talk to them, normally you don't get to spend time with your family. So I think to be able to spend time with your family and yourself is the biggest positive of this lockdown.
It is such a blessing in disguise. I mean, there's no need to get ready to go to the work in the morning, and we can work from the comfort of our homes. We don't have to be worried about kids anymore. We are getting to spend more family time together.
Indian Council for Cultural Relations has come up with a unique art initiative amidst the global battle against novel coronavirus. Speaking exclusively to AIR News, ICCR President Dr. Vinay Sahasrabudhe said that the initiative provides people a unique opportunity to express themselves in these uneasy times of a global contagion.
And the objective is to make the global community conscious about various aspects of Indian culture. And one of the aspects of Indian culture, Indian philosophy, Indian worldview is that the world is a family, Vasudhaiva Kutumbakam. So, in a situation like lockdown, when people are feeling lonely, then people are feeling that they are insecure, they are feeling there is a sense of uncertainty everywhere. In these times, it is required that they are given a sense of being connected with each other.
Participants are required to send high-resolution photos of their work to ICCR by the 1st of next month.
UN Chief Antonio Guterres has suspended the rotation and deployment of the peacekeepers until 30th of June to mitigate the risk of transmission of the novel coronavirus. Speaking at his daily press briefing yesterday, UN Chief spokesperson Stefan Dujarric said that their priorities are to ensure the COVID-19 free status of incoming uniformed personnel and mitigate the risk that UN peacekeepers could be a contagion vector while simultaneously maintaining their operational capabilities. Mr. Dujarric said to prevent and contain the risk of transmission of the deadly virus, rotation and deployments of individual officers and police and military units has been suspended until 30th of June, and the decision has been transmitted to all troop and police contributing countries as well as to all relevant peace operations. He added that a few exceptions may be considered to continue to deliver on the mandate, but only in extenuating circumstances. India is among the largest troop contributing nations to the UN. Brazil's President Jair Bolsonaro, in a letter to Prime Minister Narendra Modi, has invoked Lord Hanuman Sanjeevani Quest to request New Delhi to export hydroxychloroquine, the anti-malaria drug. Hydroxychloroquine, the anti-malarial drug that the US President Donald Trump has touted as cure for corona patients, has become one of the most sought-after drugs worldwide. Mr. Bolsonaro wrote, Lord Hanuman brought the holy medicine from the Himalayas to save the life of Lord Ram's brother Lakshman.
The News Services Division of All India Radio, in its bilingual live phone-in program tonight, will bring you a special discussion program on COVID-19. Dr. C.H. Mohan Rao, distinguished scientist, CSIR, will participate in the discussion, and this can be heard tonight on FM Gold Channel and additional frequencies from 9:10 p.m. onwards. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi discusses COVID-19 situation with leaders of different political parties through video conferencing. Home Ministry directs states to ensure availability of essential goods at fair prices for citizens. Health Ministry says 402 patients recovered in the country so far. Government to set up 3 levels of healthcare facility for management of COVID-19 cases. Several agencies and organizations have come forward to help country in the fight against novel coronavirus, and UN suspends deployment of peacekeepers till the 30th of June in the wake of coronavirus pandemic. And with that, we end the midday news.